Good afternoon. So,
Good
how you doing?
afternoon.
How you doing?
I'm doing great. How are
Doing
you?
good. I'm doing great in yourself. So, what's your name?
Willie Capers.
Willie Capers.
hmm
And what's your profession?
All right. So I'm a pharmacist, and I'm also a faculty member here at Texas Southern University College of Pharmacy and Health Sciences.
Okay. Well, I have a couple questions for you.
All right.
One of the biggest topics leading today in this world is about cannabis use and the change over time and the attitudes. Talk a little bit about, what are some ways or some views of weed and how it's changed over time? Like, how have you seen it change over time?
Yeah, that's a pretty good question because I've certainly seen it change over time. So I can think about maybe my time when I was growing up of what the perspective was about. Well, I can even say, you mentioned cannabis and you also mentioned weed. I don't think people even knew, scientific names, or they didn't call it by scientific names back then. You did have some people call it, by a scientific name if they were trying to be fancy. But I'm saying today, even that distinction and kind of knowing what chemically it's made of has changed because there's been a lot more knowledge that's been shared. So it's changed out a lot since that time. Back in the days, do not use it. Only a certain type of folk would use anything related to marijuana, cannabis, weed. To now, there's been a lot of recreational use from pretty much folks from all walks of life. So it's changed a lot.
And speaking of change, in terms of the stigmas
Mm-hmm.
with marijuana, with
Mm-hmm.
cannabis use,
Mm-hmm.
what stigmas have you experienced personally between smoking, the different forms with edible smoking? What stigmas have you experienced personally?
Yeah, so I've definitely seen various stigmas related to it. Like I said before, there was stigmas, period, no matter what form. And then probably when I got into my mid 20s, I would say it would start changing. So, there's stigmas associated with like smoking marijuana versus folks that may have utilized edibles, and that's back in the days. Edibles are totally different now than what they used to be, because they're manufactured now, edibles, and they have all kind of different things. So it's widely used today in various forms other than smoking. So I still think that there's perhaps a stigma related to smoking marijuana that there's not with other forms of marijuana, even though the amount of CBD and the amount of THC in it is the same. So it's just I think we've destigmatized overall marijuana, but there might be certain stigmas related to smoking. So you said personally. So when I was in college, I had a roommate, and who I mean, every time you would see this guy, he would smell like marijuana. So he used to smoke in our apartment sometimes, which meant that sometimes we put on our clothes and like, what in the world is going on
Right.
here? You go out to some place and say, oh my goodness, man, what have you guys been doing? And it was just, kind of interesting that, and I think it was my kind of first encounter of stigma, related to certain things. Even though that's not something that I, personally did. As I said, I had friends who did, and sometimes if you're in that environment, they can't tell you from versus the other person, but you could, if you weren't in that environment, people may say or treat you a certain way versus if you were, well, they may make assumptions, you don't know anything and all of this kind of stuff. So I've seen that, and that's definitely while you may have certain stigma like that in isolated times, that is not the I think the overall stigma today. It's just maybe a couple of days ago, I was in a grocery store. Guy passes through, walking in a grocery store, a very popular grocery store, um, walks in and was like, "Oh my goodness, what is he doing in that car?" Because you could definitely tell that he was smoking marijuana, but there was no, there were police that were there. You know, nobody rushed his car or pulled him to the side or did anything. He was able to just go ahead and go on about his day like everyone else that was in the store. So I definitely think, in my opinion, progress has been made as far as destigmatizing marijuana use, as well as not creating stigma around people that are actually using marijuana. So
Okay. Um, Speaking of which, you said something very interesting that you are a professor of pharmacy.
yeah.
So you kind of have some experience in knowing the medical uses of marijuana as well.
Mhm.
Judging from that standpoint, what form does medical cannabis come in? And also, how would you describe your opinion on the uses of medical cannabis
Yeah.
as well?
So it varies. So in it's there's been a form of marijuana used for a very long time, even when there was stigma around it. So you had, for a very long time, you had tablets, okay, that was widely used in cancer patients. It was also used in patients that had difficulty eating, so it would be used to stimulate appetite. So it's been used like that for a long time. It is a controlled substance, right? But it's still it's been medically used for a long time. Now, because of destigmatizing efforts, more science being out as it relates to marijuana use, there are a lot of forms. So pharmacist compound, um, CBD type oils, creams. They have patches now. So there's and then you are still some patients are asked to use a certain amount, and they are able to just purchase it from a dispensary, whatever they can do. So if they wanted to use oils, creams, and topicals in that way, they could do that depending on what it's being used for. But there are also folks that use edibles as well. There are certain certifications that we look at, certain quality standards that we look at to ensure that whatever's on the packaging is accurate. But as long as it's from a credible source, really the outcomes that are associated with it are are going to be the same.
Okay. Um, if you had to say, how is medical cannabis handled differently than recreational cannabis?
Ooh, that's a great question. My short answer would be that it's not handled differently, but there are some differences, right? So as I mentioned, those tablets, for instance, the controlled substances, so you would have to go to a prescriber, a physician, a nurse practitioner, or a physician assistant with a controlled substance license, to write for that particular prescription, and you would have to get it filled by a pharmacy that has a controlled substance license as well. So for some um, agents, that you would have to go to a physician and get a prescription and go through a pharmacy. But for many agents that are available, you do not. So you still, in those cases, and that's where most of the use comes from, it doesn't have to go through that particular process. So that's why I say it does not. You can, and it varies. So of course, in Texas, the laws are different than where there are in some other states where things may be a little bit even more widely available than they are here in Texas. Yeah, but as far as what amounts, what are other products that are part of um, the whole marijuana family, because it's not just one chemical, that's involved in it, but only one chemical today is approved in Texas, and may have trace amounts, but you can't have greater than a certain amount of some of the other chemicals in marijuana. But you have those available in dispensaries in various forms. in other states where you have um, more freedom, as far as legally, they have more forms, that are available as well, So they're in larger places for you to get those forms than are available, here in Texas.
Um,
And again, some of that is what we call self treatment. So you mentioned about, kind of medical use versus recreational use. Sometimes just because someone went into a dispensary, they read up, maybe found online, this is good for pain. So they're using it medically for a pain purpose, but they didn't necessarily go to a doctor or talk to a pharmacist about it. So that's still a part of self therapy, no different from you know, other over-the-counter medications that we have. If you have a headache and you go get Tylenol, would you call that recreational use or would you call it medical use, right? This is medical use. I'm using it for a medical purpose, but it's available to me without having to go to a physician or a pharmacist, right?
Okay.
So that's why I said it, that whole process, though, for some, they don't look at it the same way, right?
Right.
But that is a part of our self therapy, self care treatment process that we have for other medications that we call over the counter.
So, given everything as far as like with the medical cannabis and its usage,
Mhm.
um, where are the consumers seeing the most of the benefits from medical cannabis? And do you think it actually works for patients, or does it provide a placebo effect?
Oh, that's a great question. Let me do the last part first.
Right.
So studies have shown, well, let me say, placebo effect, doesn't mean zero, right?
Right.
So in most studies, even if you give someone a placebo, they found effect from it, right? But it's not as great as the effect that they found with the active drug. So where have you seen that with medical marijuana? You've seen greater effect than with the placebo. If I didn't give them anything or gave them an inactive substance, the marijuana has worked better. And that science has been out for a while, even with um, inhaled marijuana, not necessarily edible or other topicals. We've seen that chemically there's been effect. There's been effect in nausea control. There's been effect in appetite stimulation. There's been effect in pain management. Now, some folks are, finding some other things like there's been some effect in gout, but a better effect in gout as it relates to the pain, not necessarily as it relates to the active disease itself. So there's been medical effects and better than placebo for a while. That evidence has been out there, but because of availability, because of stigma, people haven't been using it, and to be honest, because of our lack of knowledge as well as healthcare professionals, we weren't using it, but now there's been a lot more evidence from credible sources that say, okay, we can use this and we can use it responsibly. And so I do think that there's still a hesitance, if you will, to use it because, of course, because of THC uh, and the amount of THC uh, that may also be available. This is outside of what we call CBD. There can be addictive properties as well, right? So we do measure that with other medications that we give patients, and if there's a high risk of addiction, then we try to limit the use of those agents or stay away from them completely. So that's what you're trying to manage, what you're trying to balance. We don't want someone to get addicted to something, even though we're trying to treat something medically. But I can say this a little separate from the CBD discussion. That's the balance that we're doing right now with other medications that are available for medical use only, not for recreational use, but they're being used recreationally. But they may have high addictive properties. So it's the same kind of thing, that we're trying to manage with folks. But to say that they don't work will be inaccurate. But we used to say that many years ago. but we know that for some indications it does not only work, but it works well, and it may work better than some of the things that we currently use today.
Last question. According to inside higher education, the use of marijuana for college campuses in Texas have found that nearly 40% of students use it, and more than 26% use it on their campuses. Excuse me. So, based off of these findings, what would you say this says about the change in attitudes towards marijuana or cannabis use?
Well, I do know that there's been a change in attitudes, but I would say that the use on college campuses, those numbers may not have changed that much. The reporting of it may have changed, certainly, you know. But I do think that the attitudes have changed. I think the attitudes not only of those college students being exposed to various forms of marijuana earlier in their life. Not that they took it, but that they may have seen other people either have edibles and there not be any problem or stigma associated with it. So they may say it's okay to try. So we know that that does exist and is leading to increase in use. But also just knowledge of other folks to not um, have negative perceptions or biases toward people who are using marijuana. That, like we talked about before, the stigma has changed. So that creates an environment where you say, okay, it's safe, you know, and I won't be judged or treated unfairly for decisions, you know, that I've made, that I'm allowed to make, right? So I think that that's contributed to a greater acceptance, a greater environment that says, "Hey, I can try this and I'll be okay." But I think, you know, if you talk with various generations, they will say, "Hey, yeah, we had use on our campus," and if you say, "Was it 1 out of 4?" You know, listening to the numbers that you have, I'm pretty sure that if you put 4 people in a room, those 4 had one person, you know, that was trying to. So I do think that it's been available on campuses, and there's been use on campuses before, but maybe it wasn't accepted um, publicly as much as it is today. And I think that that's very good to be accepted, because then people are more likely to tell you the truth. Because if it's not accepted, then people are more likely to lie, so you don't know kind of what's going on. And then you're like, I don't know what happened to this kid. We don't know anything they were hiding. Whereas today, that's not the case. You know what folks are doing. We're better able to tell them about limits. Many other things that we were able to do with alcohol back in the days, where we could say, hey, these are the limits that you can have. These are the symptoms that you should look towards. You can do better education so that people are safe. And I think that that's why you're not having some of the things that we experienced back in the days, where people ran into difficulty and they had issues. You don't have as much of that anymore, because there is an ability to overdose and things like, but you're not seeing that as common, even though use has increased. So I think overall, that's to me a pretty good sign
Okay, well,
of a more responsible use.
absolutely, absolutely. Well, again, we appreciate you for your time. Thank you so much for this interview, and we appreciate you.
All right, thank you.
Thank you.
All right.